G'day folks, Tony Angus here. Welcome back to the Escalating Behaviour series. And for those of you who've been following along, we've actually got a long way into why people escalate in their behaviour. We used the model of escalation, which is a simple line graph. We talked about how disagreements form and how to help people prevent those. We talked about how behaviour escalates and how to understand different behaviours. We talked about what happens if we get it wrong and it continues to escalate. And we talked about some communication strategies. But the main thing I hope you got out of it was a look at different reasons why people escalate in their behaviour, different reasons why people become aggressive. There's not just the one reason that you should draft your policies towards fixing. It's a multitude of reasons, but we've categorised them down into three main ones. If you're joining us for the first time, back you go. Head back to number one because you've missed out on vital information and just not going to be able to pick it up. So you need to go through the series in order so that you can keep up. Alrighty, so we're up to number three now, the third reason that people escalate in their behaviour, the third reason. So let's have a look at this reason. Altered conscious state. Altered conscious state. So, what typically causes people to be in an altered conscious state? Well, you will know, and maybe some of you deal with a lot of these people. Drug or alcohol affected, mental illness, acquired brain injury, dementia, delirium, autism, those sorts of things. It could be sepsis, a blood sepsis. It could be a brain tumour, which is a clinical reason, which affects the brain in an acquired brain injury manner. So, but one way or another, it's an altered conscious state. Now, why is this important? Well, because first of all, they don't mean it. A lot of people, people with an acquired brain injury have quite often had their personalities changed by the injury. So they've been involved in an accident, a car accident, and they've hit their head on the window and, they've given themselves a traumatic injury to the brain and it's changed them. Drugs and alcohol in large quantities can affect the brain. Lack of oxygen for a period of time can affect the brain, etc. So there's a number of things, illness, injury, tumour, etc. Quite often they can't help it. We know that people on certain drugs behave in certain ways, and it has nothing to do with whether they want to or not. And why is that important? Well, it's important because we need to recognise that this is not a bad person you're dealing with. So just to help you remove any attitude you feel towards those people. These aren't bad people, they're people with some damage going on. It also means, however, that typically when we look at the verbals and the body language of a person who's escalating because of some sort of damage, then we know that what's going on is quite random. It's a little bit random. It's certainly erratic, but it has that kind of, and I don't mean this to be too disparaging, it has that kind of crazy quality to it. So I'm going to write up in here random because people with drugs, on drugs, behave differently to people with mental illness, behave differently to people suffering dementia, behave differently to people with an acquired brain injury, certainly behave differently to someone who has autism. And so there's many, many aspects to it, but it's quite random and there's a certain quality of crazy to it. So just bear with me while I write that up. Okay, so you can see now we're talking about these things. We're talking about people with those sorts of injuries to their brain, that sort of functional damage, and it's causing certain behaviours to unfold as a result. Now, one of the other points that makes this really relevant is that quite often communication is not possible with a person who's one of these, a person who's in an altered conscious state. They may not be able to understand what you're saying, respond to what you're saying, or appreciate what you're saying. So if you're dealing with a person who's on a crystal meth, for example, ice, would be a great example of a crystal meth. Crack cocaine, any of those things, they don't care what you say. So they may be not in a mood to be able to respond, as well as not physically or mentally capable of responding. And so there's a difference there. So what it does is it tends to minimize communication as a strategy. And so whilst we've got down here, communicating with the gorilla, you use supportive language. Communicating with the snake, you use limit-setting language. Communicating with someone in an altered conscious state is going to be difficult. But what I recommend you do is select from one or two here. Because if you choose to communicate, you must have the sense that the person is in a state of mind that is communicable. And if that's the case, and they're communicating with you, maybe that altered conscious state is actually in loss or gain, and that's the disagreement that they have. But the difference now is when you have a look at an altered conscious state, we may not know what their disagreement is. It may be a disagreement that sits wholly and solely within them. They're upset about something that you never find out about and have no idea. So a quick story. I was running some training at a hospital that had an acquired brain injury ward. And there was a guy in there, one of the patients, who'd been involved in a really drastic car accident, and he had some traumatic brain injuries going on. And it had changed his personality. But he was known among staff for being in the middle of tasks, like putting together a jigsaw puzzle, and then suddenly standing up and walking over and assaulting staff for no reason. So if that's the case, we don't know what their disagreement is. All you know now is you get alerted to this at this stage. But that's so true for many organisations. So if you're an emergency services operator, a paramedic, for example, you turn up to traumatic experiences where you haven't seen the stuff that's gone on before. If you're in the emergency department of a hospital, people run in off the street already in these stages, sometimes even up in here, and we just don't know what's going on for them. So with altered conscious state, you have to make an assessment of their demeanour and not necessarily know what the disagreement was. Now, here's the beauty. I've got to tell you, I find altered conscious state to be slightly easier to deal with because you rely more heavily on the other options available to you here in the model and not so heavily on communication. And so when we do our session on the tactical options model, we're going to fill in some of those blanks with, what are the options you have available, and then you'll understand that dealing with an person in altered conscious state is easier. Let me give you one simple example. A person who is raging and on ice, you don't have too many options. You're in fight or flight yourself. We're either out of there and lock the doors and let that person rage, and if they destroy the waiting room, that's what happens. So we've fled. Great English. We've fled. If you choose to stay, then you've gathered security around and you've tackled that person to the ground and you've restrained them and you've taken them off for processing, given them to police. Or if they're suffering from a mental illness and raging, you've secured them, escorted them to a seclusion room or an isolation room in order to help them calm down. So you've been reduced to fight or flight, but that's essentially cut out much of that model. And so the decisions you make are much easier. The outcome is harder because getting physical with anyone is difficult. So if you've got a person on drugs, they're going to be strong, they're motivated for violence, whereas you may not be. But your decision about how to handle them is pretty clear cut. We're either going to run out and lock ourselves away, or we have to do something physically for that person. So the tactical options are easier. Okay? Now, it gets more sophisticated, the less violent the person is. Because don't forget, once they get up into physical, they're removing our options as well. If somebody wants to get, if I ball my fist and I hold it up to you, you have now two options: go or fight. Block, parry, move, dodge, weave, punch me back. These are your options. I have, by my actions, put you into a necessary fight or flight. All right, so you'll see I've included some information down here. What we're talking about now is if you choose to communicate with someone suffering from an altered state of consciousness, either choose supportive or limit-setting language, depending on what the protagonist, the other person, is bringing to the table. If the person in front of you in an altered conscious state looks as though they're suffering from some sort of loss as well, people who are delirious, for example, or suffering dementia, quite often are very fearful, and that's a loss. So treat them as if they're suffering from some sort of loss and use supportive language, all right? If they get physical with you, if this person is getting physical, there are very few options left. More likely they've put you in a fight or flight, a necessary fight or flight. So be satisfied with that, okay? And that's the way that works. So we're trying to sort of give you the best responses that are available to you in that time. So we have now 3 reasons people are aggressive: loss, gain, or altered conscious state. We've got the signs, we've discussed the signs and symptoms behind those. What body language and facial expressions does a gorilla portray? What does a snake portray? And what does a person in altered conscious state portray? Now, for the sake of political correctness, I'm not giving person in altered conscious state an animal, okay? Someone with a mental illness doesn't need to be ridiculed by me giving them some animal, okay? It's a sad thing, and I'm not here to disparage people with mental illness. We need, as a society, to support those people, not to be ridiculing them. So I'm not going to give them an animal. But you can look at the lost person as a gorilla, the gained person as a snake, all you like. I don't care about how they feel. Altered conscious state, different situation. But we've looked at the way the body language and verbals. Person in an altered conscious state, you know their verbals are not going to make a lot of sense. For various reasons, depending on whether it's a mental illness, depending on whether it's delirium, if it's autism, or if it's substance affected. Their communication is going to be different. Okay, so this is not a session about understanding the different mental illnesses, okay, but knowing that there are different mental illnesses, they present in certain ways, and when they do present in certain ways, if that's aggression, then we've got tactical options. So the next time I'm with you, I'm going to talk to you about what tactical options are available to you. We've already used one, which is communication, and we've discussed that at length. Now let's have a look at some of the other ones for your safety, all right? So the next time, I look forward to talking to you about those tactical options. If you've got any queries, please write them in. If I haven't covered something sufficiently, let me know, okay? This is not meant to be a university program. This is meant to be an awareness thing. So I'm giving you what I believe is the most essential truth about managing aggression. Next time we'll do tactical options, and I look forward to seeing you then. If you've liked this post, do what we always do. Click like, share it with your friends. Share it with your friends, because you know you've got a group of friends, like a family tree, but this person here has their own group of friends, and so the video goes to them as well, and then one person in there shares it, and now it's gone. That's what we want, more people in this community. Make sure you subscribe to the community, okay? It helps to belong. It also means you have a voice. If you want to have me talk about something, let me know. Anyway, enough waffling. Thank you for having me, and I look forward to seeing you again very soon. Enjoy the rest of your day. Ciao for now.